The coronavirus outbreak is forcing hospitals to change how they operate. New York's Mount Sinai Hospital has turned a normal cardiac unit into one for COVID-19 patients. Dr. Umesh Gidwani is the director of the cardiac ICU and shows us how they're doing it.
This is Dr. Umesh Gidwani, director of the cardiac ICU. This is normally a cardiac unit. And I want to show you how we've, changed this unit to take care of our COVID patients. So to finish our complete PPE, we're going to wear this N95 mask. And then if we are going to enter the patient room, we're going to wear a face shield, an impermeable gown, and gloves as well. Okay, now we're going to walk around the unit to see the work of the day as the people toil in the front lines. This is our ICU. Everyone is pitching in. We have here Dr. Matteo, who is a cardiac intensivist, Dr. Pradhan, who is a critical care fellow. Here we have Dr. Matt Levin. Dr. Levin has been instrumental in leading the effort to devise the tubing so that we can split a ventilator to be able to serve two patients. It's a fairly complex design.
We're taking what we've seen many people do online and adding what we think is the most important element, which is valves to control the flow and let you titrate what's delivered to the patient, and one-way valves to prevent backflow to actually do it. So we've been testing it in our anesthesia simulation lab on two high-fidelity human patient simulators, both connected to a single ventilator. It works extremely well.
They're getting ready to do a tracheostomy on a patient. They're using PPEs called PAPRs because they're going to do this surgical procedure, and it's going to be done at the bedside.
We were able to transfer a patient off the unit. It's the first patient that I've been directly helping take care of, who we successfully extubated and who was able to go to a step-down unit. So I found that very encouraging. Even though the patient, had some comorbidities, they were able to, successfully come off the vent.
The day is coming to an end. At least the 12-hour shift of the day shift is coming to an end. Soon I'm going to change back into my street clothes, take off my hat and mask and scrubs, put them in the hospital laundry, and have a quick shower, hopefully scrub the coronavirus off my body, if not of my soul, and sit down with the family for dinner. Thank you.
Louisiana is becoming another coronavirus hotspot. Yesterday, the state reported more than 2,700 new confirmed cases. There are now more than 10,000 cases in Louisiana, and more than 300 people there have died. Critical care physician Dr. Joshua Denson joins us now from New Orleans. And Dr. Denson, your state has more than 10,000 confirmed cases. What are you seeing as you're treating patients there?
Good afternoon. We're seeing a severity of disease that is on a par with what we usually have for 1 to 5 patients, but now we're kind of having the entire ICU filled with that severity of disease. Mm-hmm. And the problem that we're running into, or I don't want to say the problem, but one of the issues we're running into is the attention that those patients require is intense. It's the intensive care unit. So we're kind of running into some issues just kind of keeping up with that. But so far, every day seems to be pretty similar. A lot of the patients are pretty similar, actually.
The Louisiana governor said earlier this week that the state's very low on ventilators. Does that match with what you're seeing?
I think across the state, we're seeing some variability, and I think that we definitely could use more ventilators here. The hospitals that I'm working at right now are managing fine. So it's not affecting my care directly, but anticipating that this is going to continue to rise, it could become an issue very shortly.
The governor also extended the state's stay-at-home order through April 30th. Does it seem to you like people are following that order?
I really do. I think people have been listening to the governor.
That's
and
great.
I think he's been very proactive in that. And honestly, in my opinion, I think that's one thing that over the past week, 2 weeks, we've really been excelling at.
Louisiana saw a spike in confirmed cases this week, 2,700 new ones yesterday alone. In a statement, the governor said that was because of a backlog in commercial testing. From what you're seeing, what is the testing situation there?
Well, I work at Tulane School of Medicine, actually, and us, as well as other places in the city, have developed more rapid testing. And now we actually can have a turnaround on testing within the same day, within a matter of hours, which has been extremely helpful in identifying which patients to isolate and which patients are the highest risk. Although I will tell you, I mean, just after seeing so many of these patients now, I mean, looking at certain factors about these patients, you can usually identify them as being very likely even without that test.
How about personal protective equipment? Do you feel like you have the equipment you need to stay safe? I know this has been a huge problem at hospitals across the country.
I mean, it continues to be a huge problem everywhere. It's not just everywhere else, it's here. And I think every hospital is doing their best to try to ration at the same time as keeping their employees and staff members and doctors and nurses safe. It's a very challenging situation, though, without a lot of communication from across state lines, as everyone has continued to talk about. So I continue to express that I'm still concerned that we need more gear. Just being asked to reuse gear that we're not used to using and is made to be disposable, it makes some people more uncomfortable. So this, I know, is being addressed on several levels, but it's one area that I think we should still be very vocal about and pushing to find solutions.
There was some hope that we might see the virus die off a little bit in the summer months, maybe a little bit like the flu does, but it's already pretty warm where you are. Do you think the weather could have any impact on the coronavirus?
I mean, I sure hope so. I can't tell you if that'll prove true or not. We're still seeing a rise in cases, as you already said, and the weather is warm down here. It's been in the at least 70s and 80s for, I'd say, over a week, if not multiple weeks. And we haven't quite seen that slow down, but I hope that it does. That's all I can say.
We know New Orleans is a hot spot right now, but this isn't just a city problem. Coronavirus is spreading in rural areas, too. What would you tell healthcare providers in places that haven't been hit hard just yet?
That's a great question. The way that to prepare best is to just think about what you have as far as your availability. So the first thing to know is, what are your resources that you have? How many ventilators do you have? How many beds can be converted to an ICU bed, which means if you can convert it to a negative pressure environment, meaning where the air is constantly moving out of the room to make it the safest environment for your employees. I'd start there. Aside from that, you can also obviously look at your personal protective gear. And even if you're not rationing it, just take that inventory would be the first step. And then the second step is obviously staffing. And staffing is a huge issue. I know, I volunteered to help my friends in New York from a telemedicine perspective. And I know they're struggling to get staffing to help. You have plenty of space, you can find beds and even equipment, but if you don't have the people, the nurses, the respiratory therapists, the housekeeping are the most vital components that go into the care of these patients. Without them, you're not going to be able to do anything. So I think those are my two biggest recommendations right now.
How about for average folks living in those areas that haven't been hit hard yet? What would your best advice be for what they should do right now to try to stay safe and to protect themselves from the coronavirus?
It's funny you say it. So I've been following the coronavirus since beginning in Wuhan, and talking with my wife about preparing. And initially, everybody's assumption is, oh, we're prepared. Everything, you're overreacting. And I hope people keep telling me that I am overreacting, but things that I would prepare if, you don't know what you're going to need necessarily until you need it, right? So making sure especially your medications or whatever you rely on a day-to-day basis, making sure you have some stockpile, assuming, worst case scenario. And obviously a food supply and a resource, especially if it's a family member about that you need to be there, you are taking care of, or that is taking care of you, and how you're going to cope during periods of isolation that may be forthcoming. For us, it involved babysitting, which one of my cousins has been helping us with, thank God. But other people, it could be any sort of care or needs that you have on a daily basis, including your job and whatnot.
Dr. Denson, it is great advice. A lot of people trying to figure out how to deal with this. Thank you for that. And thank you so much for all of the work that you're doing. We just can't thank our healthcare professionals enough for what they are doing to save people's lives and to keep us safe. We are so very grateful. Thank you for what you do.
Thank you so much.